YouTube channel. This is Harish and today we will learn about different imaging modalities practically and theoretically about chest x-rays. Let us begin with some of the projections of the chest x-rays. There are different projections taken for chest x-rays. Generally we will take posterior anterior view, anterior posterior view, lateral view. In decubitus we will take right lateral decubitus or left lateral decubitus view. Now we will see the indications of the chest x-rays. Indications means why this chest x-ray is performed, to see which pathologies with chest x-ray is required. This is the normal chest posterior anterior view. This is anterior posterior view. This is left lateral decubitus view. Here we will see clearly chest x-ray in lateral position, and lateral positions of spines are clearly visible, and also we will see descending aorta, aortic arch, pulmonary artery, right ventricles and left ventricles also we can see in left lateral decubitus position. This is how we will take decubitus view. This is chest apicolaudatic views. Here we will see clearly the apices of the chest. This is the normal posterior anterior views of the chest x-rays. Here both lungs are clearly visible and the heart shadow is also clearly visible. The posterior, this is the pneumonia of the chest, where the air sacs is filled with fluid or pus, which inflames the air sacs in one or both the lungs. It can be caused due to bacteria or virus in air that we breathe. This is the tuberculosis of the lungs. It is one of the serious infectious disease in lungs caused due to bacteria called Mycobacterium tuberculosis. It may be spread from one person to another through tiny droplets released into air via cough and sneeze. This is also a communicable disease. Here we are seeing clearly that right side of the lower lungs are completely damaged. This is the cardiomegaly of the chest x-ray, where we will see the shadows of the hearts are swelling. If we measure cardiothoracic ratio, it will be more than 50, so as to determine the cardiomegaly. This is also important information that something is there wrong with the heart. This is the dextrocardia images, where the heart lies in the right side of the chest. It is mostly seen in few people. This is the normal condition. This doesn't cause any effect to the human beings. This is chronic obstructive pulmonary disease, which we will also call it COPD. It is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. It also causes inflammation of the lining of the bronchial tube, which carries air to and from the air sacs of the lungs. It causes people shortness of breath. This is lung metastasis, which appears as peripheral rounded nodule of variable size scattered through both lungs. It is generally large and numerous in the chest as round patches. It is also asymptomatic and primarily tumor, which determines by hemoptysis and pneumothorax. In this chest x-ray we are seeing different patches of the lungs in different portions of the lungs. Pneumothorax, it can be caused by blunt or penetrating chest injury or due to RTA. It occurs when the air leaks into the space between your lungs and the chest wall. It also caused collapsed lung. In this pneumothorax, the air pushes on the outside of your lungs and makes it collapse. Patient preparation. It means what things patient should do before taking the chest X-rays. The patient should be asked to remove all clothing and jewelry. If required, she is asked to wear hospital gown before taking the chest. Women should inform their physicians and X-ray technologists if there is any possibility that they are pregnant. Many imaging tests are not performed during pregnancy as not to expose the fetus to radiations. If X-ray is necessary, precautions will be taken to minimize the radiation exposed to fetus or body, and proper consent of patient are also required. During the exposure, you must hold very still and may be asked to take deep inspiration and hold for few seconds to reduce the possibility of blood image. If you will not hold the breath during the chest X-rays, then the pathologies we can't determine. Chest X-ray is typically the first imaging test used to help diagnose symptoms such as breathing difficulties, cough, chest pain, injury, fever, shortness of breath, and many more. The chest X-ray is also performed to evaluate the lung, heart, chest wall, and the chest X-ray produces the images of the heart, lung, airways, blood vessels, and the bones of spines and the chest. Now let us see some of the anatomies of the chest X-rays. This is the normal posterior anterior view of the chest X-rays. Here we are seeing the trachea clearly. The black air indicates that the trachea is in normal position, and carina, which differentiates the bronchus into left and right bronchus, which runs into the lobe of the liver. The right hilum and the left hilums are clearly visualized. Clavicle, costiocardiac angle, right hemidiaphragm, left hemidiaphragm, costopheric angles, breast shadow, also seen in female patient. Aortic nerve also we will see. The bronchus are also clearly visible, and spinous process we can count with their number. In this chest X-ray, ribs are clearly visible as we can count from top 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12 also we will see here. Right lateral lungs and left lateral lungs. In right lateral lungs we will clearly see 3 lobes are there: upper lobe, middle lobe, and lower lobe. But in left lung we will see only 2 lobes, upper lobes and lower lobes, and these are separated by a line called lingula. In right lungs, lobes are separated through minor fissure and major fissure. Thanks for watching my videos. Here we studied one theoretical portions of chest X. For practical portions we will see in next video. Please subscribe and like my channel and comment below what things are to be customized. In next video I will come with an improvement.